Your Excellency, your critics, especially your political opponents, says that you and the NDC cannot boast of any social intervention policies. Will you mind share with us what have you done on this social intervention policies in this country?
I've heard this thing said so many times, and I wonder the basis why they say so. The NDC has no social intervention programs. It's the funniest thing I heard. Who brought the District Assembly's Common Fund concept? It was the NDC. We put it in the 1992 Constitution and said 5 to 8% of total government revenue should go directly to the districts for their development. So if you go to your district and the District Assembly has built a school, a KVIP, a nursery, a sports recreation, a community center, it is a social intervention of NDC that has produced that. Who introduced the GET Fund? It's Rawlings, NDC. We passed the GET Fund law. But for the GET Fund, where would our education be? Most of the educational infrastructure in this whole country is being provided through the GET Fund. And so, how can you say we haven't introduced social intervention policies? But in any case, what is social intervention policy? Is an action or policy that provides social services or social benefits to the people. And so it's not only GET Fund and other things. We have provided more access to water than any other government in the history of this country. When Professor Mills came into government, access to clean drinking water was 58%. By the time we left office, access to clean drinking water was 76%. For Accra alone, we added 40 million more gallons of water. In 8 years, not 1 gallon has been added. And I hear the Ghana Water Company say, oh, Accra is overgrowing its supply of water. It's overgrowing its supply because in 8 years, you have not added a single gallon to it. You must plan and know what your population growth rate is. And you must continue to put in the capacity to bring in more water. And that's why I'm saying that we took water and brought it in from the northern direction of this country. And so Adenta and other places that had never gotten water for almost 15 years saw their taps flowing for the first time. Today, I'm sure your taps flow twice a week or something. If you don't store water, you will run short. And so we need to invest to bring more water supply, not only to Accra, but to all our growing communities around the country. And so if you are a government and you haven't invested in improving water, definitely access to people will be denied. We've extended electricity more than any government in the history of Ghana. Electricity is a public good. When electricity arrives in a community, it changes the lives of the people very rapidly. People can engage in small-scale enterprises. It was Rawlings who introduced the Rural Electrification Program and the National Electrification Program. And so today, when we say that Ghana has more than 80% access to electricity, it's because the NDC introduced those policies for us to be able to do so. So how can any person say that NDC has not introduced any social intervention? Even the NHIS. NDC started a pilot in Damango and Nkranza for the NHIS. Implementation started in President Akuffo's time. But what President Akufo introduced was a mutual health insurance scheme. And so your card, your NHIS card, allowed you to access health services only in the district in which you were registered. Today's National Health Insurance Scheme was introduced by Professor Mills. He changed it from a mutual district insurance scheme to a national health insurance scheme so that your card could access health care anywhere in Ghana you go.